when I was diagnosed, there was no treatment. The only thing that the doctors could tell you was diet and exercise. Uh, there were no drugs at that time. And my wife and I listened to our doctor and took his advice, and we did successfully implement a complete change of our diet. And I lost 70 pounds over the next year and a half. So I was a typical American fat boy, if you will. And, it was critical to my recovery that I got my weight down to a reasonable value. But at that time, the entire treatment was diet and exercise. Things have changed a lot since my early diagnosis. A year ago, we had the first drug approved for the treatment of NASH, and that was Resdifra that was produced by Madrigal. And that really was a tremendous change in how liver is managed, because the question before that was whether it was druggable, whether people could succeed and bring a drug to market. And this proved that it was possible. And today we have a number of drugs in trial that we're very optimistic about and looking forward to having much better opportunities to treat the disease going forward. When I was diagnosed, I, of course, went to the internet, and I was astonished that there was almost no information about NASH. NASH cirrhosis was, you just didn't find information about it at that time. And it's one of the things that led me to create the Fatty Liver Foundation was we simply had to, as patients, have access to more information. And today, I'm just really pleased that, you can find a wealth of information about liver disease from every perspective today. And it's a huge, huge change in the last 10 years, which is, certainly helpful, and really valuable to the patient community. The environment today is very encouraging from a patient perspective, because some of the things that have happened from when I was diagnosed is that today we actually have a standard of care which defines that primary care should be looking for asymptomatic liver disease. And that is a tremendous advance, which just didn't exist when I was diagnosed. And it's going to give us the ability to save lives, because if we can identify this disease early, we don't have to reach the desperate times that you get to with advanced disease. And in terms of the consequences that relates to Blue Fairy, liver cancer is one of the fastest growing cancers that we have today. And it's really vital that we relieve stress on the liver and thereby reduce the incidence of liver cancer. I think that's just an absolutely critical aspect of patient care today.